All right, welcome everybody to our webinar today. Our topic is your retirement roadmap. We have got a star-studded panel of people talking today, and we're going to try and cover four sort of areas or topics within the retirement sort of realm. First up, we're going to have James Knapp. He's our chief wealth architect at Boyum Wealth Architects, talking about sort of the retirement planning. And then Tenor Stowe is with Wealth Architects as well. He's going to talk about the Social Security. That's a big piece of it. Joining us from the Schatz Benefit Group is Sandra Juddin, and she's going to talk about Medicare and sort of the considerations with Medicare planning. And I will wrap up talking about taxes, of course, a little bit of tax planning and sort of how that factors in, how the new tax bill factors into that. I will say yesterday we recorded a full hour just about the tax bill. That recording and slides, they are posted on the website. So if you want the full deep dive on the tax bill and year-end planning, go there. But I'll try and just focus on some of the retirement ideas and how that's affected by the bill. So without further ado, I'll turn it over here to James to talk about retirement planning.
Hello, thanks, Chris. There are four key components to retirement planning when we think about planning for retirement. Retirement planning is having enough money to financially support yourself through the rest of your life in our industry. As a certified financial planner, that's what we're trained to look at. First step is understanding what a working budget is. Do you have a working budget? Do you know what your annual expenses are? Understanding how much money you spend on an annual basis is the key. It's the foundation for understanding if you're financially independent or you can retire. We often track it, so there are many different free tools that you can use to do that. And so you can track your expenses today quite easily. Most people use a lot of credit cards, or they know what their fixed expenses are. It's the variable expenses in your budget that catch up to you. My grandfather is 97 years old yesterday, and he told me 3 cars ago was the last car he'd ever buy. And so those are one of the expenses that show up occasionally because cars don't last forever and people need to still get around. Investments and your income is number two. Have you reviewed your investments and your income streams to ensure you have enough saved for retirement? So now that you have your budget and how much money you're going to spend, let's look at how much you have saved and where those sources of income are going to come from. Major source of income for most people is obviously Social Security, and Tenor will go through that today. So I'm not going to spend a lot of time on that, but I am going to talk a little bit about how you've saved your money. Do you have it in your 401k, your qualified account? Do you have it in a Roth IRA, or do you have it in an after-tax savings account like a brokerage account or checking in savings, money market, stuff like that? Depending on where you've saved your money, depends on where you pull your money from and what the taxation is on that. Chris is going to talk about taxation more, so I'm not going to get into that. But understanding how much money you can pull from a distribution rate, and there's different rates of return that you should assume. The old rule of thumb to last 45 years, let's say you're going to retire at 60 to 65 years old. Generally, we run our plans out until you're age 95. And so we'll look at 30-year distribution rates. You should look at a 4.1 to 5% distribution rate annually to be able to sustain yourself for those 30 years or 35 years that you're looking at. The next one is risk management. So in risk management, we look at, do you have long-term care needs? How much money do you spend on property casualty, depending on where you live today? If you're in Florida, it's really difficult to get insurance for your house in case something bad happens. Oftentimes, you can't even get insurance in some areas of the country today. And so, Maslow's law of hierarchy is food, clothing, shelter. Everything else after that is kind of a want versus a need. And so we look at how to protect yourself from a risk management perspective. how much you're paying for those risks and how much you want to self-insure or how much you want to pay to have the risk transferred to another company. The next one would be number 4. So the next slide is it says tax planning. We're going to talk a little bit about tax planning here. So if you retire before age 65, you're going to have Medicare, Medicaid coverage. Sandra is going to talk a lot about that today, so I'm not going to cover it in a lot of detail. But the way that Medicare is calculated is based on your adjusted gross income for the prior several years before you hit 65 is what your Medicare premiums are going to be. And that's an IRMA charge. And so that's how that's calculated from an expense standpoint to cover your health insurance. Roth conversions is another opportunity. So if you have an IRA and you're retired after the age of 59 and a half, you can do Roth conversions, or Roth contributions are required moving into 2026. If you're doing the catch-up contribution in 2026, that will be after-tax dollars that's put into a Roth IRA for you at retirement. So the timing on that matters actuarially. It makes no difference whether you pay the taxes today or in the future. It just depends on how you want to pay those taxes, because two things are true in life: death and taxes. And then you have to understand what your tax bracket is and how to maximize that tax bracket every year. So you can keep your adjusted gross income lower in some years, and some years it might be higher, depending on your income streams when you get into retirement. Biggest thing is to have a plan, how much you're going to spend every year, and then plan for your distributions in future years and understand what tax bracket you're going to be in future years as well. Early IRA distributions are available to people if you retire before the age of 59 and a half. One of those ways to do it is called a SEP, or substantially equal periodic payments. Before the age of 59 and a half, you can withdraw money from your IRAs. You have to do it equally over a 5-year period of time. So if you started at 58, you have to continue those distributions until you're 63. Or if you start at 55, you have to continue it until you're age 60 of equal distributions annually. And you establish this with Chris and his team. The tax professionals actually calculate this with you. But you can retire early and pull money without penalty from your IRAs before the age of 59 and a half. Next slide, number 5, the last part of this is Social Security and the essentials for retirement with Tenor. So I'm going to turn it over to Tenor.
There we go. Thank you, James. So yeah, I'm just going to cover kind of basics about Social Security, claiming options, and some strategies to think about as you're planning your own retirement. So first of all, Social Security is designed for income retirement. There's also disability and then survivorship situations. And so we're going to focus on the income and retirement part, but you could have disability insurance, Social Security insurance that could affect it, or like I said, survivorship that you've previously had Social Security on. But Social Security primarily is funded by payroll taxes. So while you're working, that's when you're paying into Social Security. And that's where you're building up that benefit while you're working. And then while you're on Social Security, it's incoming payroll taxes that are paying a lot of those benefits that then you are actually receiving. When it comes to actually calculating your benefit and figuring out how your benefit, or figure out how much your benefit will be, it's based on your 35 highest years of earnings. And so they look at the 35 highest years. If you did not have 35 years worth of earnings, then there would be zeros in there. But they look at that 35 highest years and then come with what they call a primary insurance amount. And so when you actually go in and look at your Social Security benefit on SSA.gov, or you get your benefit statements, what you're seeing on there is your primary insurance amount, and it's based on your earnings history, which you're able to go back and actually look at. So then when you're looking at your Social Security options, a lot of time you're starting with looking at the full retirement age. Kind of what people notice, it's somewhere between 66 and 8 months and 67, depending on when you were born. But that full retirement age amount is when you're able to claim one option for claiming your benefits. And we'll talk about some reasons why you might want to wait till full retirement age or kind of the reasons that take it before that. But then with when you can claim your Social Security. So you can claim it as early as 62 or delay as late as 70. So if you claim it at 62, you would get a reduced benefit compared to if you waited till 70. So every year you delay taking your benefit past 62, your benefit goes up by 8%. And so that's one of the reasons that people do delay, is that you wait from 62 to 63, your benefit goes up by 8% by waiting, and you lock in that higher benefit then for the rest of your life. And so balancing out when to take it, obviously, the longer you delay it, the more you don't have that income coming in. But delaying it allows you to have that higher income then for the rest of your life. So that's what the trade-off is a lot of the times, is looking at your own longevity and for you or for your family history to figure out if you live longer, usually better off delaying your benefits to lock in that higher amount versus if you need the income now. So sometimes when you do retire, especially if let's say you retire at 62 or earlier, at 62, you maybe just need to start the income. So then that would be the decision, that would make the decision for you. Then on the next slide, going to cover some of the strategies. So one thing I want to make sure we covered was a spousal benefit. So I know I mentioned that your own benefit is based off your highest 35 earning years. Well, what if you don't have much for earnings history? Well, if you are married, there's a spousal benefit that the lower earning spouse can receive based on the higher earning spouse's benefit. So how it works is the lower earning spouse is actually able to qualify for 50% of the higher earning spouse's Social Security amount. And just for a simple example, if two spouses were both 67 and the high earning spouse went to start their Social Security at 67, the lower earning spouse could also turn on a spousal benefit Social Security amount worth 50% of the higher earner's benefit. And so that can be a huge benefit if one spouse has significantly higher earnings throughout the year, or if one spouse has years where they don't have any earnings history and so have a kind of a reduced benefit there. And so then there's also strategies around that you want to look at around when can you actually take your own reduced benefit as a lower earning spouse and then switch to a spousal benefit later. Because one of the caveats with the spousal benefit is that the high earning spouse needs to have started their Social Security for the other spouse to be able to take that 50% benefit as well and start that spousal benefit. Another thing to consider is survivor benefits. So if you are a widow, you're actually able to start Social Security as early as 60. So there are some reasons that you would be able to start it at 60 and maybe some reasons you'd want to. And the widow benefit can be separate from your own Social Security benefit. So really looking at, well, how can you start getting benefits even before that age 62 while still continuing to grow your own benefit potentially for later. And then lastly, there actually is spousal benefits even if you're divorced. So if you're married longer than 10 years and have not remarried, you can actually you could still benefit from that 50% spousal benefit, even if you're no longer married. Go to the next slide. So then how do taxes work? I don't know, Chris is going to cover taxes more in detail. Just wanted to cover high level. One thing you probably hear about is that 85% number. What it is 85% of Social Security may be taxable. So it's not taxed at 85%, but 85% of it would be subject to taxes, to income taxes. And so with that as well, different states have different rules on if it's taxed or not taxable. In Minnesota here, potentially taxable, potentially not, depending on your adjusted gross income. So depending on your state, obviously, whether it's taxed at the state level, but at the federal level, up to 85% of the benefit would be taxable for you. And then one of the reasons that full retirement age matters that I mentioned earlier is if you want to work while taking Social Security. And so this is a common question is, well, what if I'm at 62, 63 and want to supplement my income by starting Social Security? And so there's some things to consider there because if you start Social Security before your full retirement age, you actually are limited to how much you can earn through working before your Social Security is reduced. And so you can earn up to about $23,400 while taking Social Security before full retirement age without it reducing your Social Security benefit at all. But once you earn more than 23,400, your Social Security starts being reduced. And the more you earn, the more it's reduced. And there could hit a point where you actually earn enough throughout the year that the Social Security benefit is actually reduced to zero. And so making sure that if you do start your Social Security before full retirement age, have a good idea of what you think your earned income would be if you plan to work. And so income from pension or IRA distributions or dividends, interest, things like that do not negatively affect your Social Security from this reduction risk. It's just if you are going to work mainly. And benefits do get recalculated later, and you do get that money back that they withheld, but it can limit a lot of the benefit of why you had started Social Security on the front end. And so then just to wrap up here, just a couple kind of action steps. First, running a personalized timing of your Social Security. And so especially, if its spouse is looking at how do you maximize the benefits between two people? So one thing is, if you are married, the higher benefit gets retained. When one spouse passes away, the higher benefit is still retained by the surviving spouse. And so it doesn't matter which spouse has the higher amount, but the surviving spouse, when one spouse passes away, retains the higher benefit between the two of them. So really looking at how do you maximize the amount of your Social Security, if you're a couple, between the two of you for your lifetime, and then figuring out how do you align taking your Social Security with other income sources. So figuring out when do we need to delay it or when do we need to start it depending on other income sources, or when you can actually benefit by delaying it and taking from different income sources depending on your tax situation and what other income and investments that you have. And then one recommendation I have to do today is if you haven't done it, go to ssa.gov and claim your account. I know they've run campaigns on this, but it's really good to make sure you have access to your Social Security account. If you've done this before, it's good to sign in regularly. They changed how you have to sign in recently, so you have to get updates there. But the reason to make sure to go in and check it out is you can see your benefit based on your earnings history, and you can make sure it's correct, make sure it all looks correct as you go through that. You can use a calculator on there to actually figure out, well, based on when you want to retire and when you want to take Social Security, what the amounts there would be. And then lastly, when you do sign up, if you haven't signed up before, they do make you answer some questions. If you get them wrong, they will end up sending you a PIN in the mail in some situations, which can take a couple weeks. So it's good to get it done early so that you're not trying to log in once you are actually trying to apply for Social Security or you're at the point where you really need that information. Thank you. And now I think I'm passing over to Sandra.
Hello, perfect. Well, thank you so much. Again, my name is Sandra Jutton, and I work at Schatz Benefit Group, and we've been partnered with Boyum. And we really, again, want to focus today on Medicare planning, what those parts mean. We'll go very much into a high overview of that. I think for timing's sake, if you do have questions for me, if you can throw them into that Q&A box, that way when I'm done presenting, I can go in there and answer those for you. A little bit about us here. So as a broker, what we do is we're really going to compare your options. So we are licensed and appointed with all the different carriers in Minnesota, the large companies. So Blue Cross, Medica, Health Partners, Humana, United Healthcare. I know I'm missing something, but all the major companies we were able to work with. And we're going to give you our recommendation based on what's going to be the right option for you. So a recommendation is really tailored to your needs specifically. We don't want to go with a plan that, everyone says is best, because that doesn't necessarily mean it's best for you. And then we'll take it a step further and assist with the entire enrollment process. So that way, again, we're able to make sure your plan goes into effect properly. And as your broker, should issues come up, we're going to be able to help you with billing issues, claim issues, because let's face it, insurance has claim issues from time to time. And then we will also help you with reviewing that coverage year to year. So we know that, again, your situation can change, your plan can change, And it's really important to take advantage of the renewal process to ensure you're still in a cost-effective option going into the next year. As far as our meetings, we do a lot of things virtual, just like this, as well as over the phone. But if you are someone that prefers that face-to-face meeting, we are located in Burnsville and Stillwater as well. So if both of those locations, like I said, are too far of a commute, we can certainly do presentations just like this. As far as cost, brokers are compensated by the insurance company that you enroll in. So you are not paying a servicing fee. You're not paying a renewal fee to us. We are truly shopping for you. And again, the insurance company will compensate us. Again, no biasm, whether we go one way or the other. The compensation truly is the same. That's all regulated. Complimentary consultation you can schedule with our team at any time. My name again is Sandra Jutton, and I'm the Director of Medicare and Individual Business. If you are someone that is looking to start the enrollment process with, should I enroll in Medicare? Do I want to defer it? Paul Chacos is our leading specialist on the Medicare side. So again, if you need help figuring out, should I enroll in Medicare or should I defer it? And then really shopping all your supplemental plan options, he is our go-to person. And then Nikki Fouth is our specialist that helps with the 64 and younger. So if you are someone or your spouse might be someone that is looking to figure out, okay, should I elect Cobra or should I talk to someone that might help me find a plan on the open market? She is really our go-to gal there to help crunch numbers. So to get into our bread and butter here today, Medicare. Original Medicare, Part A and Part B is completely administered through the federal government. So what that means to all of us is that you, your spouse, your neighbor, your friend in a different state, Medicare coverage truly is identical for everybody. Differences for what people pay come down to where their income falls into place or what they picked for private insurance on top of A and B. So again, coverage with Part A and Part B is truly the same. This is a red, white, and blue card. And if you are collecting Social Security benefits when you're getting ready to turn 65, automatically enrolled into Medicare, and they're really good about sending this card out about 3 months prior to your birthday. So if your birthday was in December, you more than likely would have got this card that beginning part of September. If you are not collecting Social Security benefits, nothing will happen. So in order to start Medicare, you have to apply. And as we mentioned in the other slide, all of that is done right through the Social Security website. So it's Medicare, but it is all harbored into that one portal with Social Security. And I have really great instructions, Paul does, in getting you enrolled if that's what you need to do. Now, you are always eligible for Medicare the first of your birth month. So if your birthday was December 31st, you are able to start Medicare as of December 1st. You do not need to wait for the following month to apply. Now, Part A and Part B, Part A is going to give us a hospitalization coverage. So really, if we're inpatient, hospice, skilled nursing, Part B is going to be really all of our medical. So our doctoring, our surgeries, our lab work, testing, you name it. And what I can't preach enough is that this coverage truly is partial. So partial hospital, partial medical. What Part A and Part B do not do is protect us at 100%. So if you are reading those articles that say return to original Medicare, you need to have something on top of that because you do not have a safety net put in place. So again, Part A, Part B, partial coverage. Now, private insurance are going to be those other letters that you hear about. So this is going to be with those insurance companies, and this is where us as brokers start that process of that plan elimination. What's going to be suitable for you? So when you hear Part C, I really want you to reference that as an Advantage plan. Advantage plans are also going to typically give us that Part D drug benefit included. So it is an advantage to have Part C and Part D all in one plan together. Now, what Advantage plans are doing is they are coming in and placing an out-of-pocket cap onto your Medicare A and B. This is so much like our employer coverage. You know, with your employer plan, there's a safety net of where it ends for you. So that is what those Advantage plans are doing, is they're capping Part A and Part B. Now they're going to throw in additional benefits that Medicare unfortunately doesn't give us coverage for. So you'll get more benefits only by going with the Advantage plan with dental, vision, and hearing. So and again, Advantage plan to have everything tied in one option, one ID card, there's simplicity there. Advantage plans, they also all use different provider directories. They also use different formularies. So we, on the broker side, again, are dissecting where do you need to go to the doctor, who's going to cover your prescriptions best. It's a very complex situation, and this is something that we do every day to help simplify that process for you. Now, your second option is going to be called a Medigap plan. So again, Advantage is one option. Second option is Medigap. And you will hear people call Medigap plans true supplement plans. And I want you to just lump those two into the same category. It is the same type of plan. It's just more terminology to make this more confusing for all of us. Now, these plans are a little bit different. So they have a very high premium starting point because they're kind of considered more Cadillac type coverage. So you're paying more on the forefront to not see a bill. With that, you do not get vision, hearing, and dental. You also will not get drug coverage. So when people do want to go the Medigap route, we also have to pair that with a drug plan. And then if you want those additional things, again, like vision, hearing, and dental, we'll have to add those in. So kind of think of Medigap as an a la carte option. You're kind of picking and choosing all these different things. One thing with Medigap plans, and I always say this is the important part to note, is they allow you to go anywhere you want that Medicare is accepted. So you do not need to worry about network restrictions with Medigap. You're also able to permanently relocate and take that plan with you. And then the biggest thing is that they are the only plans left on the market that still have health history questions on their application. So Medigap plans will give you what's called a one-time guarantee issue onto the plan, which means no health questions asked when you are new to Medicare. So when you're new to Medicare, you are guaranteed on and guaranteed renewable year to year. If you start with an Advantage plan and 5-10 years down the road, that Medigap plan looks a little bit more appealing to you because, you know, our health typically decreases over time, we run the risk of not being able to get you on a Medigap plan based on how you answer those health questions. So just know that that is a stipulation with those types of plans. Next slide, please. The cost, this is the big one because we need to know what these things are going to cost us in retirement. Well, Part A, if you've ever wondered what that deduction was coming out of your paycheck that says Medicare, fear not, here it is. It's your Part A, and as long as you have contributed up to 40 quarters, 10 years into that, you will have a $0 premium. Part B is a little bit different. So in 2025, we do see a standard premium of $185 per month per person. And we did see that jump up to $202.90 per month per person in 2026. Now, when I say standard, that is what everybody pays. Should you fall into higher income brackets, so if you are single and making $109,000 or less, you will be in this category of the $202.90. If you are a couple and you are filing together or separate, it actually doesn't matter. It's $218,000. And they are looking at your income from 2 years prior to the calendar year that we are in. So once we do get into 2026, they are going to assess what your income was in 2024 to figure out what your Part B premium will be. Now, those thresholds just keep increasing and the Part B premium increases as well. And if you do wonder, again, based on where your high income falls, we can talk that, you know, during a consultation so that way you have a definite answer. But again, standard, everybody pays, higher incomes will see increases. If you are collecting Social Security, they will deduct that right out of your benefit check. You won't see the bill come, it'll be automatic. If you are going to delay collecting your Social Security benefits, they are going to bill you for it, and it'll be a quarterly bill that comes. So 4 times a year, 3 months at a time. Now, Part C again are Advantage plans, and you are going to see a very broad spectrum of premiums to choose from. So there are $0 plans. They are out there. They do very much exist, and they'll go all the way up past 300. What we're doing in this large threshold of premiums is trying to figure out if your needs are minimal, can we budget a $0 premium with a higher out-of-pocket maximum? Or are you somebody that's a little bit more middle of the road where a $100 premium might be better to have, so-and-so out-of-pocket maximum? So there's, again, kind of a way to figure out what we want to budget monthly so that we can afford the insurance, right? But then really true when it comes to should you use it, what out-of-pocket are you okay with that you can budget? And that's really how we assess that level of premium. Now, Part D, this is the drug coverage, and it's a broad premium range as well because it really depends on the prescriptions we're taking. If you're someone that's on those low-key or low-cost, lisinopril, atorvastatin maintenance prescriptions, we're going to be able to keep you on the lower premium scale because your prescriptions are very cheap. If you are somebody that might have more name brand or specialty medications, in order to get them covered for one on the formulary, and then for two at a decent cost, we might have to hike that premium up so that way we can again get those covered for you. But we aren't just picking a drug plan out of a hat. We have a really great website that us brokers use to figure out, okay, based on the prescriptions entered, your dosages, the pharmacy, what drug plan is going to spit out the lower cost for you. And that's how we assess that. Medigap, as I mentioned, that premium starts high. They are really going to just keep going up year to year, unfortunately, but they're Cadillac type coverage. So you're paying that higher premium to have that. Next slide. 3 major enrollment periods for you in the Medicare world. The first one being what's called our initial enrollment period. This is the window of time when it's 7 months when you are turning 65. It is not 7 months before your birthday. I get that question all the time. It is 3 months before your birthday, your actual birth month, and then the 3 months following your birth month. This is the window of opportunity for us to figure out, are you going to enroll in Medicare and then getting you all set up? Or are you going to defer it because maybe you're going to continue working or your spouse is going to continue working? All right, let's just double check that you've got credible Medicare coverage so there's no penalty down the road. We'll talk about all of that with you. Second is called the annual election period. This is really referenced as open enrollment for us, and it's always the same time frame for Medicare. So it's always going to be October 15th through December 7th. This is that time frame that I mentioned in the first slide where we're going to review, what changes happened with your plan, what changes happened with your life or your prescriptions that we might need to, again, look at alternative options. Very important to be able to connect with your broker at this time, just to ensure there's no further action needed on your part. Third is our special election period. After you've turned 65, you're entitled to start Medicare whenever you want. You do not need to wait for an open enrollment period to retire. So if you're, again, thinking, I want to retire in June, well, we'll help you get everything set up then with Medicare July 1st. We'll help talk that timeline so that way there's no lapse in coverage. But you do not need to wait for open enrollment to retire after you've turned 65. Next slide. Part D is a big one, and it's a big one because prescriptions have gotten so out of hand with the cost, but we do have some good news. So Part D, again, is not through Medicare. It is offered by the private insurance companies. In 2026, there is an annual out-of-pocket of $2,100 for drugs that are covered under the plan formulary. What that means is you will not spend more for prescriptions in the calendar year past 2,100. Should you hit that, your prescriptions will go to $0. Every carrier has a different formulary. They can tier drugs differently, and it's always critical to confirm how those drugs are covered. If carrier A covers your lisinopril at $0, but carrier B covers it at $10, I mean, which plan do we want to go with, right? So it is crazy, but they can cost that different between plans. Next slide. With the annual cap of 2,100, the carriers have put in place what's called a prescription payment plan. In case you are someone that is affected with a $10,000 prescription and you're going to hit that 2,100 cap the very first time you go to fill, you might not be able to budget that 2,100. And so what the carrier is going to offer is you the option to sign up for the payment plan where you can do monthly installments of that 2,100. That way, again, you can budget it through the entire year instead of trying to come up with it all at once. And really, if you are someone that is taking a brand name or a specialty medication, it's going to actually flag to the carrier when you go to fill it so that they can send you the information to apply for this if you need it. It's not required, it's just an option for helping. What to consider in this marketplace? There's so many things to take into consideration these days. Coverage and benefits. This comes down to making sure that what are the core things that you want included in your plan? You need to make sure that the network includes your doctors, your specialists. Can you travel outside of Minnesota and have coverage there? Accessibility, are we getting the timely response too from the carrier on being able to access your over-the-counter benefits or access your member portal online? These are huge things. Security, trust, and brand equity. I think if we've all watched the news, we know that insurance has taken so many twists and turns. And I think that just again, trying to remember that, Minnesota-based companies instead of these national known companies are something that, they're trying their best to be valuable to people that are Minnesota residents, whereas some of the national companies, they don't necessarily know our level of doctoring in Minnesota. So they're not kind of picking out those key core benefits that we need. And so this is where we will come in and again provide recommendation based on what you need. Service and communication. This is really for us on the broker end is are you getting a hold of us in a timely manner? We take pride in ourselves at this time of year that you're getting responses from us in a timely response or timely matter. I'm sorry. And that we're being transparent. We're telling you what's going on in the market. If something's better, yes, we can certainly show that to you. I think what we need to know is going into 2026, there really isn't some magic golden plan. And we're really just kind of trying to figure out, can we afford the insurance and what that premium is going to look like and how that works for you. So this is all, again, things to consider, but it truly comes down to, your doctors, your specialists are covered and prescriptions are covered and that we can budget that on a monthly basis. Next slide. Questions. Perfect. So that concludes my presentation. I did see some questions go in the chat box, so I will go ahead and address those so that way I keep all of us on time. Thank you guys so much again for having me.
All right, thank you. I learned a lot about Medicare. I hope you're still around when I am turning 65. So let's talk a little bit about the tax planning. As I said, we did an hour yesterday and went through a slew of individual and business tax updates. I'm not going to go through all of that today, but I want to highlight a few things that are going to directly impact how you are thinking about retirement planning and taxes within that. So a lot of the rates and the rules have been retained. I want to highlight some of the ones that are going to be different, but a lot of stuff was scheduled to expire or go away or change. And so what they did was extend a lot of stuff. So you're not going to feel a difference in terms of the rate, but there are some areas that are significantly different. So there are some new above the line deductions. Senior deduction, this was called the no tax on Social Security. It actually has nothing to do with whether or not you are claiming Social Security. It is based solely on your age, and there's an income limit on that. There's the vehicle loan interest. Again, there's an income limit on that. Then the charitable contribution rules, they are going to change in 2026. So a key one there is that if you're claiming the standard deduction in 2026, but you gave cash charitable contributions, you can still deduct those as this above the line deduction. So it's 1,000 for single, 2,000 for joint. Tip income, overtime income, if you are still working but getting towards retirement, those are the above the line new deductions. And then there's some changes to the itemized. So the SALT cap is a big one. We'll get into that a little bit more. But historically, or the last 8 years, you've been limited to a $10,000 deduction. Now it's going to be up to 40,000, but there is an income limit on that. If you are itemizing and you are deducting charitable contributions, there's going to be a new floor of 0.5% of your AGI. So you're kind of take a haircut if you're itemizing on those charitable contributions. And then some changes for gambling losses, and a lot of the mortgage interest stuff has been retained. The rates themselves is a key thing that you are considering when you're looking at retirement. A lot of times your plan for how you're going to handle retirement and whether you're going to do Roth conversions or take some IRA distributions or when you're claiming your Social Security, a lot of it's based on, well, what tax bracket do I want to be in? And what tax bracket do I think I'm going to be in a couple of years from now? Sometimes your rates can be lower in between when you're working and like when your IRA distributions start happening at maybe age 72, kind of a thing. And so the rates themselves have not really changed. They've been retained, but this is just an example of what the joint tax brackets look like. The top tax bracket, 37%, just as it was before. So I want to be very clear that we highlight the SALT deduction and how this works, because it's new and it's going to make, I think it's really the number one tax planning item for any individual, whether you're nearing retirement or not. But certainly here in Minnesota, where we've got property taxes and income taxes that both tend to be high, it's going to make a difference and adjust your plan for taxes in retirement. And so it was 10,000 before, now it's up to 40,000. That sounds great, and it is, as long as your income is lower than 500,000. So in our example on the left, they just have wages, but it could be pension income or whatever type of income, 500,000, you're getting the full benefit of this $40,000 state and local tax deduction. On the right, we've increased the income by just 100,000. So now we're at 600,000 of income. What we see is that you lose $30,000 of that SALT deduction. And so we've increased your income by 100,000 in this example, but your taxable income has actually gone up by 130,000. And so what ends up happening is you add $100,000 of income, but your individual tax liability went up by $43,500 in this example. So it's a 43, 44% kind of a tax rate. And this has not been an area where planning has occurred in the past. And it's possible you were thinking about your retirement planning and trying to set this up. This is a new factor to consider, is if your income is in that $500,000 to $600,000 range. This is a very common example for somebody who lives in Minnesota. It was pretty easy to come up with a scenario where your effective tax rate is 44%. And so I think you're going to want to avoid that. You know, as we said, the top tax bracket is 37%. And yet what we see is between 5 and 600, you're effectively paying 44%. So that is higher than the absolute top tax bracket. So it's a new area of planning, and you want to incorporate that within your year-end planning and the way you think about retirement. So just to dive a little deeper on some of these charitable rules, because it definitely will play into how you're considering that retirement planning and tax situation in retirement. So for 2025, these charitable rules have not changed. But when the SALT cap goes up to 40,000, it means a lot more people are going to be itemizing anyways. And so I think in a lot of situations, you're going to have an increased incentive to make your charitable contributions, perhaps in 2025. You maybe didn't think you were going to be itemizing, but now you are because of this SALT cap change. And then we see in 2026, we're going to have this haircut, this 0.5% of AGI haircut that you're going to take on your itemized deductions. And so there, you're looking at, well, maybe I should do it in 25 instead because I don't have that haircut. On the flip side of that, if you are claiming the standard deduction, now in 26, you can get this cash contribution deduction. So if you're itemizing, you might want to sort of accelerate charitable into 25. If you are not itemizing, you might want to delay cash contributions into 26 or make sure you do them. So we kind of got it going both ways here on the charitable, which is sort of an odd place to be. The other thing I will point out, as long as we're talking about charitable, in 2027, so it's a ways away, but in 2027, there's potentially a $1,700 tax credit if you make a $1,700 contribution to a scholarship granting organization. There is more guidance needed on this. The state of Minnesota, or each state is going to either opt in or opt out kind of this plan. So more to come on that, but as long as we were talking about charitable, had to throw that in because it's a very unique opportunity. So let's get to kind of what I'm calling our comprehensive example. So if you're on top of it, you've been doing your retirement planning, you kind of got a plan in place, you got an idea of what you're aiming to do. And you finished that plan in June of 2025 before this tax bill passed. And so in your planning, you've got, I'm probably going to be claiming the standard deduction in most of these years because the SALT cap is low. I maybe have no mortgage left or only a small mortgage left. So I'm just not going to be looking at itemizing. So my planning is based on claiming the standard deduction. I might have come up with my plan and I'm going to delay Social Security as long as possible. So I want to, as Tenor was talking about, I want to get the additional benefits. So I want to delay that to maybe age 72. That's my plan. In the interim, you've got a plan that involves doing some Roth conversions, perhaps. And so sort of leading up to the retirement or leading up to claiming Social Security and having IRA distributions, we got these Roth conversions. And maybe your plan involved, I want to capture the 24% bracket, maybe go into the 32 a little bit. Maybe that was your plan. And a donor advised fund might have been part of your plan for charitable contributions. And you're like, I want to do that maybe every 4 years, but I want to do a big amount so that I can itemize and really get a nice benefit of those charitable contributions. Because otherwise, my plan is to claim the standard deduction. So then July comes around, they pass this tax bill, and I think you just need to reconsider what your plan was. So I think what you're going to find is your original plan might have been standard deduction. Now, based on just the SALT alone, you might be itemizing every year. So originally you had planned on, most of the time I'll do standard deduction. Occasionally I might itemize. You might be in the flip of that now. Now you're like, well, most of the time I'm going to itemize. Maybe I can get this in a situation where occasionally I claim the standard deduction. So you might have sort of the inverse situation occurring or the inverse motivation. you were delaying your Social Security. Well, now you need to consider sort of how do these extra deductions I'm getting change my tax rate, and maybe that changes my decision on Social Security. Longevity is a key part of that Social Security. If you live to be 100 years old, like a couple of my grandparents, you will want to delay that for sure. But if you're sort of on the fence and you're in between, the tax rate that you're paying on that is part of the math, it's part of the calculation. Your Roth conversion strategies, you had that before, but now we've got these income caps on some of the tax deductions. So we saw with the SALT cap, you can end up with a situation where you have a 44%, effective tax rate. But there's also going to be limitations on like that senior deduction. And when you do a Roth conversion, which increases your income, then you're going to be losing that deduction. So again, we're back to like, well, your effective rate is going to be a little bit different than you had planned on. And so maybe you want to reconsider that. Your donor advised fund strategy, you had a good strategy in place. You're like, yes, this is what I'm going to do every fourth year. Well, now maybe you need to reconsider that, because in the future, you're taking a haircut on these charitable contributions. And in your original plan, you weren't thinking that you would itemize in 2025, and now you are. So now you probably are itemizing in 25. There's no haircut. So maybe you're going to accelerate and do that donor advised fund in a different year. You might accelerate it to 25, but then also plan on sort of, does it make sense to be making charitable contributions if I am itemizing, but then I got to take this haircut? So I think you're just going to rethink a lot of these strategies. And to me, that's the point, is you kind of have to continuously stay up on sort of what are the changes. If you're in Minnesota, whether or not Minnesota conforms to some of these federal changes is going to be interesting. We probably won't know about that until even the summer next year, to see sort of retroactively, is this going to apply? So I would encourage you, certainly taxes plays a big role in figuring out your retirement planning strategy and budgeting for how much tax you want to pay. Because a lot of times in retirement, your income, some of it is things you can control and some of it is not. So you've got the Social Security, maybe you've got RMDs, those are set. But then there's the other things that you can control, like your capital gains or Roth conversions, or even the timing of when you take Social Security. So some things are fixed, some things are variable, and just coming up with a plan. Now's a great time to, I think, just to revisit your plan, because a lot of this math has changed with that tax bill. And it's going to make a big difference. So with that, I think we can take any other questions people have. James, do you think my tax advice is wise?
Yes, it was
Okay.
actually very on point, and it is critical. Your largest expense in retirement historically is taxes. So it's something that you have to manage while you're going through retirement. Not just, I call it a battle year by year. So it's understanding what your budget's going to be, knowing what your needs are, where your income sources are going to come from, and then fighting the battle against taxes. Yeah.
If there's any other questions, we can take them in the Q&A. Otherwise, all of our contact information is up here. We will post a recording of this along with the slides on our website probably tomorrow. And that 1 hour tax planning, year-end planning one from yesterday is already posted. So feel free to reach out with other questions. And, a lot of this matters based on your specific scenario. So some general advice is good, but we certainly always recommend sort of going through the specifics and making sure you got a good handle on it.
Yeah, I agree. The other thing to do is Chris has a great podcast, so like and subscribe to the Tax Tiger. My podcast is actually coming out in January. The first 4 will come out in the month of January. It's called Zombie Advisor. So like and subscribe to that. You can also find information on our blog. If you go to our website, Boyum Barenscheer, there's a lot of blog information about this. I want to thank Sandra and Tenor. They did a great job today, and Chris, wonderful job. Thank you.
Thanks, everybody.
Thank you.
Thank you for having us.
Thank you.
Thanks, Chris.
Have a great day.